In the peaceful suburban community of Maplewood, Dr. Evelyn Reed, a nationally recognized internal medicine specialist and public health educator, gave a compelling presentation at the Evergreen Community Center. Her goal: to bring long overdue awareness to a pressing health issue that often flies under the radar. In modern America, parasitic infections, with the growing popularity of global cuisine, increased international travel, and evolving changes in our food system, Dr. Reed emphasized that parasites are no longer a threat found only in tropical regions or impoverished countries. They are here, hiding in our kitchens, gardens, and even within our bodies. Understanding the hidden threat: parasites are organisms that live in or on another living being, feeding off its host for survival. They can be microscopic protozoa, visible worms, or even invisible larvae waiting to hatch. Dr. Reed began her seminar by dispelling common myths. You don't need to be traveling through a rainforest or drinking from a swamp to contract parasites. Many people in the United States unknowingly harbor them due to raw food consumption, poor kitchen hygiene, and contaminated soil or water. Infections may persist for years without symptoms, and when symptoms do appear, they're often misattributed to something else: stress, poor diet, or irritable bowel syndrome. Types of parasites that affect humans. Dr. Reed introduced three main classes of parasites known to affect the human body. 1. Worms. Helminths. These are multicellular parasites that can grow from a few millimeters to several feet long. Roundworms. Ascaris lumbricoides, commonly found in contaminated soil or food, may cause bloating, abdominal pain, and malnutrition. Hookworms. They enter through the skin, often bare feet, and feed on the host's blood, leading to fatigue and iron deficiency anemia. Whipworms can lodge in the large intestine, often causing diarrhea, rectal bleeding, or anemia. Pinworms, especially common in children. Pinworms cause intense itching around the anus at night. Trichinella, found in undercooked wild game like boar or bear. This parasite migrates into muscles and can lead to fever, swelling, and pain. Threadworms. Strongyloids. These can complete their life cycle inside the human body and stay hidden for years. 2. Flukes. Trematodes. These are flatworms that tend to settle in specific organs. Liver flukes can inflame the bile ducts, impair liver function, and cause digestive distress. Blood flukes. Schistosomes, found in contaminated water, cause damage to blood vessels and organs over time. Tapeworms. Long and ribbon-like. They can grow over 20 feet inside the intestines and sometimes release segments in the stool. 3. Other parasites. Malaria parasites, Plasmodium, transmitted by mosquito bites and capable of causing recurrent fever and organ damage. Filarial worms, e.g. Wuchereria bancrofti, responsible for lymphatic filariasis, which causes extreme swelling of limbs. How parasites enter our body is according to Dr. Reed. Parasites can find their way into our systems through several common avenues. 1. Contaminated food and water. Unwashed vegetables, undercooked meats, and unfiltered drinking water are primary sources. Sushi, rare steak, or improperly handled produce can harbor larvae or eggs. 2. Skin penetration. Some larvae, like hookworms and strongyloids, can burrow through intact skin. Walking barefoot or gardening without gloves in contaminated soil increases this risk. 3. Insect bites. Mosquitoes, fleas, and other insects can serve as vectors, transmitting parasites directly into the bloodstream. Malaria and filariasis are examples. 4. Poor hygiene at washing hands properly after using the bathroom or handling pets can lead to ingesting parasite eggs unintentionally. Symptoms. The quiet damage. Parasites cause parasitic infections, often present subtly at first, but Dr. Reed noted the cumulative damage can be serious. Digestive symptoms: bloating, cramping, chronic constipation or diarrhea. Nutrient deficiency. Parasites absorb essential nutrients, leading to fatigue, muscle weakness, and weight loss. Blood loss. Hookworms can cause slow internal bleeding and chronic anemia. Brain fog. Some parasites produce neurotoxins that affect cognition and mood. Skin issues, rashes, eczema, and even unexplained acne may be signs of systemic infection. Organ damage. Migrating worms can block bile ducts, irritate the gallbladder, or form calcified deposits that cause inflammation. In severe cases, larvae can reach vital organs, lungs, brain, or liver and cause life-threatening complications. Your body's built-in parasite defense system. Good news, Dr. Reed said, is that our bodies are equipped with an incredible defense network. Stomach acid pH 1.5 to 3.5 kills many ingested threats on contact. Macrophages and lymphocytes identify and destroy parasites. Eosinophils target larger worms that can't be eaten by other immune cells. Antibodies respond aggressively to helminths. Fever elevates the body's temperature to create a hostile environment for invaders. Vomiting and diarrhea are the body's way of rapidly expelling threats. But when the immune system is weakened due to stress, poor nutrition, or chronic illness, parasites can slip through the cracks. A holistic approach to parasite detox and prevention. Reed emphasized that modern medicine and ancient health wisdom can coexist. The best approach is proactive prevention and gentle, natural detoxification. Here's how. 1. Strengthen immunity. Sleep. Get 7 to 9 hours of restful sleep. Exercise. Move at least 30 minutes daily to stimulate lymph flow. Stress management. Chronic stress suppresses immunity. So take time to decompress. Try breathing exercises, journaling, or meditation. 2. Detox the digestive system. Hydrate. Drink about half your body weight in ounces of water per day. Fiber intake. Aim for 25 to 38 grams per day to support bowel regularity and flush out toxins. Occasional fasting. Giving your digestive system short breaks can support natural detox processes. 3. Diet and food ratio. Reed encouraged following this food breakdown: 65% whole grains like brown rice, oats, and whole wheat bread. 20 to 25% vegetables, especially cruciferous and fibrous ones like broccoli, kale, and carrots. 10 to 15% lean proteins, including fish, chicken, tofu, or legumes thoroughly cooked. Avoid raw meats, undercooked seafood, or unpasteurized dairy. Limit excess sugar, sweets, and alcohol, which weaken the immune system and promote parasitic growth. Eating habits matter. Also shared key eating behaviors. Don't overeat. Try to stop eating when you feel 70% full to give the stomach room to function efficiently. Chew thoroughly. Chew each bite at least 30 to 40 times to aid digestion and destroy any parasite eggs in food. Preserve stomach acidity. Avoid overuse of acid-reducing medications like proton pump inhibitors, unless prescribed. Natural remedies for parasite cleanser. Reed shared time-tested, accessible remedies that can be done at home. 1. Raw brown rice morning ritual. Chew 1 to 2 tablespoons of raw brown rice each morning on an empty stomach. Chew thoroughly. Aim for 100 chews per bite. This helps mechanically cleanse the digestive tract. For a short detox, she recommended eating only brown rice with black sesame and sea salt for a few days, combined with gargling salted lemon water twice daily. 2. Roasted pumpkin seed. Soak raw pumpkin seeds in pink salt water, then roast. Eat a handful daily. Chewing well, these seeds contain cucurbitacin, a compound known to paralyze worms, making them easier to expel. 3. Mugwort tea. Boil a handful of fresh mugwort in 17 flaws of water until it reduces to 11 flounces. Drink on an empty stomach, once per month for prevention, 2 to 3 times per week if actively detoxing. Mugwort also supports menstrual health, heart function, and digestion. 4. Salted lemon water. Mix warm water with fresh lemon juice and a bit of sea salt. Gargle or sip slowly to aid digestion and support cleansing. 5. Areca nut tincture. Optional, mentioned only for dental hygiene in specific cases. This traditional remedy must be used cautiously. Consult a licensed provider before trying. Daily habits that reduce risk. Reed provided simple, effective household tips. Cook meat thoroughly. Poultry to 165 F. Ground beef to 160 F. Fish to 145 F. Wash vegetables and fruits with clean water. Use separate cutting boards for raw meat and vegetables. Practice regular hand washing at least 20 seconds with soap. Closing parenthesis. DEWORM pets on a vet-approved schedule. Wear shoes while gardening or walking in soil. Boil or filter water when camping or traveling to uncertain areas. When to get tested if you experience symptoms such as long-lasting digestive issues, unexplained weight loss or fatigue, chronic anemia or skin rashes. Talk to your doctor about testing. Common tests include stool exam and pee test, usually 3 samples for accuracy. Blood tests, including eosinophil counts and nutrient levels. Imaging ultrasound or CT, when parasites are suspected in organs. Prescription medications like albendazole, ivermectin, and praziquantel may be used for treatment, depending on the type. Real-life stories from Maplewood. Reed shared testimonials. Michael Lawson, a software engineer, discovered a hookworm infection after months of fatigue and anemia. After treatment, his energy and blood levels normalized. Linda Perez, a school teacher, found relief from chronic eczema after being treated for strongyloids. The Patel family resolved their daughter's pinworm infection by improving hygiene and following the mindful eating method. Final thoughts. Empower your body's defenses. Reed closed the seminar with an empowering message. Your body is your home. Keep it clean, defended, and respected. Parasites are part of nature, but they don't need to be part of you. With small, intentional steps like chewing raw brown rice in the morning, avoiding raw meat, drinking herbal tea, and maintaining hygiene, you can build a resilient body that naturally resists parasites. The message was clear. Prevention isn't just about pills or protocols, it's a lifestyle. And it starts with awareness, wisdom, and consistency.